Hello, everyone. Welcome and thank you for joining us today. My name is Ray Slough, and I'm a solutions engineer at XTEL Communications. At XTEL, we help organizations manage their voice and data networks and help keep them safe from cybersecurity threats and attacks. Today, we'll be discussing the cybersecurity crisis in the healthcare industries and the current state of cybersecurity in healthcare. We also are going to talk about cybersecurity best practices to give you more insight into what your doctor's offices, hospitals, and senior living centers can do to help prevent cybersecurity attacks. By the end of the time today, we hope you feel more comfortable and confident about cybersecurity awareness and how it affects you, your faculty, your staff, and patients. We're passionate about cybersecurity and providing our customers with the right sized, tailored security management program that meets their business needs. Our goal today is to share some insights and top recommendations to immediately improve your cybersecurity landscape and program. Our guest today features myself, a senior solutions engineer at XTEL, Dave Barton, chief technical officer from Highwire Networks, and Craig Sandman, co-founder of Symbol Security. You can expect each speaker to talk for about 10 minutes, followed by a Q&A at the end. You can put the Q&A, any questions that you might have, in the Q&A button that you see on the screen, or on the chat button will work as well. We'll start with myself, and then I'll be giving you some insight into XTEL's network security and cybersecurity offerings. Then I'll hand it off to Dave from Highwire, and then Craig from Symbol Securities. Both Highwire and Symbol Securities were handpicked by XTEL because of their excellence in their respective cybersecurity offerings, as well as their customer service approach. XTEL is really proud to have both Symbol Securities and Highwire Networks as our cybersecurity technology partners. I just wanted to take a quick minute to review how XTEL is helping protect your network from cybersecurity threats with our solutions and products. You can hit the, there you go. You may know XTEL as a HPBX or cloud phone system provider, or as an ISP providing internet services. XTEL has been securing and managing the edge with our DDoS denial of service product and our managed firewall products. Through our product evolution and the cybersecurity landscape, we've added a few more critical products to strengthen your cybersecurity program. Penetration testing, including vulnerability scanning, which leads to a key component of HIPAA compliance, is a core product within this suite. So XTEL offers penetration testing and vulnerability scanning on your externally facing IP addresses and your internal network devices. One of the flagship products is our Endpoint Detection and Response EDR agent, powered by SentinelOne, fully managed by the Overwatch SOC. Dave will touch on that in a couple minutes. In addition to EDR, we also ingest any security event logs for a fully managed security operations center as a service platform. So XTEL SOC is fully managed and powered by Overwatch for cybersecurity 24/7, 365 log review and playbook automation. So when the offices are closed, when you don't have the staff to review all of the cybersecurity events, the XTEL SOC is a great option to help strengthen your cybersecurity. Complementing our EDR platform, we have added another product which is critical to address your biggest asset and liability, your end user. Most breaches come from an end user doing something, clicking on something, and the cybersecurity awareness training platform powered by Symbol Securities is XTEL's answer to this challenge. As bad actor vectors are getting more sophisticated, it's important to educate your end users on how they can help protect your network and data. Craig, in a few minutes, will share his experiences. So we're going to kick off and start with Dave Barton, who is Highwire Network's Chief Technical Officer and brings over 20 years of managed services, information security, and sales leadership to the industry. Over the last 15 years, he spent building managed services security offerings within the MSP landscape. Go ahead, Dave, if you want to get started.
All right. Thank you, Ray. I appreciate everybody joining today. Again, I'm Dave Barton. I am the CTO. I also am the CISO. I've been doing cybersecurity for about 30 years. Started doing it in the Air Force and have been doing it in one fashion or another for the last 30. I'm going to talk a little bit about cybersecurity. It's interesting. Every time you turn on the news, you hear about it, and you hear about it in lots of different ways. You hear about it in AI and some of the things that are happening around artificial intelligence. You hear about it with ransomware. I was talking this morning with another partner, and ransomware is a $20 billion problem. And if you didn't hear that correctly, I said 20 billion, which is more than the bottom half of the countries in the world, their total gross domestic product. And so it's a huge problem, and it's not going away. And at the end of the day, some of the most valuable records that you can buy on the dark web are healthcare records, right? It is never ending. And so we are fighting that fight with you to protect our patients and protect our customers and protect the data. And so, with that, you can see here just some examples of some of the events that we've seen so far this year. And this isn't inclusive. There are other things that we haven't seen, that we haven't, or that aren't on this map. I heard that the escalation of ransomware this year, just over last year, is about 230%. At the same time period. So January through June, it's 200% more than it was last year. It's not going away anytime soon. So with that, if you can go to the next slide. I don't know if I have the power. Yeah. What I really want to talk to is there's got to be a strategy around healthcare, and more importantly, without regard to the vertical, there has to be a strategy about protecting the data. People's like, well, which framework should I pick? And healthcare's got a very strong leaning towards high trust and HIPAA. But at the end of the day, I don't care which framework you pick. I care that you pick one and you chase it violently, right? You execute it violently. And what I mean is, go do it, right? Go do these things that we're talking about. And the reason I say that is we have folks out there who think firewalls and AV are good enough, right? They're really at that far left, sanitize the network, let's put a next-gen firewall, maybe we'll do a little segmentation, maybe we do email protection. But what we really need to be doing is moving towards the right. We have to safeguard devices, which is where EDR comes into play, identities, like awareness. Craig will appreciate me saying this, is the most important thing you should be doing in cyber. And I firmly believe that, because if we can make our people better at identifying, and I'm not going to steal Craig's thunder, but if we can make them better at identifying what looks right, then when you see something wrong, it's easy to say, no, that looks bad, let me skip that. So the identities, the data, when you get to this phase 3 of a risk life cycle, you start to do more tools, multi-factor. I would argue that we probably should move that down, because that has to be, near the front. Password management, zero trust is the buzzword. You're hearing more of that in healthcare specifically, and I'll talk a little bit about that. And the reason zero trust is interesting for our listeners here is we have built networks that were designed to share data, right? We designed them to be easy to use. And in doing so, we made it easy for the bad guys to use them and share our data with other people. So Zero Trust is a framework that says, unless Ray has an explicit right to the data, to the port, to the protocol, to the server, don't let him have access. Even if he's sitting right next to it, he can't get on it. And that Zero Trust is what we're starting to see in this space get some momentum, because there's technology out there today that helps facilitate that. 10 years ago, we were talking about Zero Trust, and it was more a pie in the sky idea because there was no way to do it yet. But it's got to be in your thought process. How can I take away access to stuff people don't need, right? Doing so reduces my attack surface, reduces the ability of ransomware. If your janitor logs in, there's no reason he should have access to patient records, right? Just think about it logically. So Zero Trust says he doesn't have an implicit right or an explicit right. He can't touch those machines. That's where we're going. And then as you get into this framework where you're doing continuous improvement, all of these things that you see here are things that you should be thinking about. And I tell this to people a lot. Just because the tool you have today was great yesterday doesn't mean it will be tomorrow. And so you continuously need to be looking at, how do I deliver better services in cyber, protect the data more efficiently, more effectively, automation, et cetera, et cetera. And that's really what this slide is talking about, is a journey from, I don't have a framework, I don't know what to do, let me start at one. And as I build a framework, I follow the framework, I start implementing controls, I get to 2, 3, and 4, and ultimately end up with a program that I'm continuously monitoring, improving, and making better. And so, can we go to the next slide, Ray, please? This is where this framework comes into reality, right? At the end of the day, there are tools out there, and I'm not trying to sell tools, by the way. I'm trying to sell outcomes. When you go to a hospital, your outcome is you want to get better, right? It's not, I want this drug, I want this surgery, I want to be better. And at the end of the day, in the cyber world, we're focused on the outcome, which is, let me catch it quick, right? The quicker I catch a virus, the quicker I can get rid of it. And so the outcome is mean time to detect, mean time to respond. If I can prevent things from happening, then I don't have to detect them, which is what this slide really talks to. We have a bunch of services that focus on prevention, and then we have some that focus on detection and response. And in the middle of all of that, and this is the critical piece, how do you get through the data? How do you sift through the output of user behavior analytics as well as network operations center alerts? How do you get through the noise? And automation is the only way to make that happen. And so, to give you some idea of scale, we tend to see anywhere from 155 to 200,000 events a month that a human has to look at. That's a ton of work. Just think of the human capital that requires to sift through the noise. And we built this automation platform that sits on top of all of our controls that you see here. And we take human processes and we automate them. And so we're still looking at 155,000 events, but now I'm whittling that down to where my humans only have to look at 200 or 300. And so the rest of those, I am iteratively, I hate saying that word, but it's such a great word, iterating through all of those events. And I'm applying the logic and the smarts that my top analyst would do in that case, and I'm doing it automatically. And so now my top analyst can focus on the things that are anomalies or the things that are outside the norm. this is how we help solve that problem. Because again, my outcome, guys, is how quickly can I detect it and how quickly can I respond to it. And if I can shrink all that down, I reduce the impact of ransomware to an organization. I reduce the impact of a bad guy breaking in, stealing patient records. The last thing I want to talk on this, by the way, on this slide is this IoT thing. And I know we're talking specifically about healthcare. And one of the challenges that healthcare faces is this idea of IOMT. And if you haven't heard it used in those terms, I had one of my friends in healthcare correct me. It's not IoT, it's IO medical technology. And the challenge we face is you've got these patient life-saving critical devices that are on the network that I can't put an agent on. I can't put EDR on them, right? I can't scan them without maybe knocking them off the network. I can't do some things. And so what hospitals have done is they've done a very tedious, cumbersome process of separating them physically, logically, trying to manage rules, and it's just painful. And so we have one of our partners, 7,000 biomedical devices, and we put this solution in front of them, and then within minutes we are doing full zero trust to those IOMT devices without putting an agent on, without replacing the network. And it is the only thing that we've seen in the industry that helps solve this problem. So if you've got a lot of IOMT, there are solutions out there. And by the way, we deploy it, we manage it, we help the hospital manage that infrastructure, and it works. It works beautifully. I don't know what else I have left, Ray. Could you go to the next one, please? Is that my last slide? All right. So this is possibly my last slide, and I apologize, I'm not sure. The other thing that we have is this opportunity around a hardware inclusive managed firewall. And why this matters is this service matters to you is it does a lot of things in a single device that is an OpEx expense as opposed to replacing or buying all of these things in a CapEx fashion. And so with this solution that we're talking about specifically, we have the ability to do SD-WAN. So if you've got multiple internet connections and you want to have failover and you want to have high availability, this solution will switch between those internet pipes in milliseconds. The end users don't ever see a degradation of service using SD-WAN. It also has the ability to do things in that internet pipe like content filter, looking for malware, inspecting traffic, all of those things. And this service just makes it easy because my team, we have a 7x24 ops team in Batavia, Illinois, they're watching. And when something goes bump in the night, and it will at 2 a.m., we're going to monitor and respond. So next slide, please. Look, I can talk all day, and that's not what you guys want. EDR, at the end of the day, this is probably the second most important thing in a cyber program, is having a tool closest to the data that will protect the device. And that's where EDR comes in. We manage that, we deploy it, and we monitor it. And when something bad happens on that device, i.e., somebody plugs in a USB key and it has malware and it infects that machine, we're going to isolate, we're going to quarantine, we're going to roll it back, and we're going to keep that machine up and running while we fix it. And so great solution. It saves so much work. It's really designed to take the risk away from the endpoint. And that's what the EDR is for. I see a Q&A. Oh, IOMTs. All right, great question. And I'll come back to this slide in a second. Some examples are MRI machines, heart monitors. It's interesting, hospitals have heart monitors that a patient wears that connects to the Wi-Fi, right? It's not, I guess it is kind of life-saving, but at the end of the day, that data goes to the Wi-Fi but they can't protect that device. And I'm not a healthcare guy, by the way. So there's a ton of them. I probably don't know the answer to that question, but you know, IV machines, blood infusion machines. I hear about all these things that I'm not real smart at, by the way. But they're IoMT devices. They're internet connected medical devices that they can't patch and protect. That was one of the QAs that we had. So I think this might be my last one. Why all this matters and how do you bring it all together is this idea that we have a SOC platform, which is this picture you see. We're pulling in all of the data sources, and those data sources could be the proxy filters, it could be the firewalls, the EDRs, all of those things into a consolidated viewpoint or a dashboard. And then we correlate all of that data together. And why that's important from an operations perspective is, think about your house. You have multiple layers of protection, right? You have walls and doors and windows. You may have a alarm system with motion sensors, and you got a guard dog, maybe. I mean, I have a German Shepherd, and she'll scare you, but she'll love you too. You might have a safe in your house for all your important papers, and you might have a gun. So you've got defense in depth, right? If they get through the doors, you got a dog, you got an alarm, you got all these things. But if your alarm system's not accounting for the window in the basement, you're going to miss something, right? And so what this XDR does is it takes in all of these data sources and correlates them and says, this event and this event are tied together. And so while individually they might not be high risk, together they represent something bad. And a great example of that is somebody's using Ray's account at 2 a.m. and maybe it's Ray, maybe it's not, but they're failing and they fail on the password, but then they get in. So they brute forced his account. And you correlate that with geolocation. Ray lives in Kansas City. I don't know where Ray lives, but I'm just making it up. He lives in KC, let's say, but the account's logged in at 2 a.m. from Iran, right? That correlation of those two data points tells me the risk is really bad and we need to do something differently than where Ray normally logs in from Kansas City at 2 a.m. If you're not bringing those data sets together, correlating them, building behavior profiles, you're never going to catch that attack. And so this SOC platform is what we focus on in managing the outcomes. Again, mean time to detect, mean time to response. Next slide, please. All right. So, the critical benefits, these are for everybody that healthcare, SLED, education. We focus on looking for the anomalies. We focus on tying data sets together. We give you our expertise with your tools, and we build a model that says when we see something, we take action. We build automations that say when we see these things repeated over and over, instead of having a human do it, let's do it at machine speed. Let's let the machine do the work. And so at the end of the day, our goal is managing the outcome. And the outcome is when something bad happens, we catch it quick and we remove it quick. That has to be our goal. And with that, that's probably my last one.
Yeah, there you go.
All right.
Dave, thanks a lot for that. Can you, Dave, take a second? There was another question put in. Oh, I think we can just answer it now. Just how the EDR platform assists with ransomware, protecting against ransomware, and then maybe talk a little bit about the kill, quarantine, and rollback switch that we have built into the platform.
Yep. So most of the good EDRs, there are some that aren't great, but they are looking for a couple of things. They run on the machine, Macs, Windows, Linux, and they look for some things. They look for pattern matching. So they know that when this and this together equals this. So there's pattern matching, traditional virus definitions. They stop them from executing. They see it, they know what it is, they stop it. The EDR piece, the evolution of that is now they're also doing what's known as AI or machine learning on behaviors. So the problem we face, rewind to ransomware, it's a $20 billion problem, is they are constantly evolving their techniques to get by the tools that we're managing to protect them, right? So it's this constant battle between we detect it, we block it, and they change a few bits and bytes and they do it again. And now we're in this constant fight. What EDRs are really good at is saying we see a behavior that we haven't seen before on that machine. It's a process, it's an encryption, it's memory spike, whatever. And we know it's bad. And in doing so, we quarantine the behavior. We stop the process, we quarantine the file. If ransomware begins to execute, we roll it back to the known good. And so all of that happens in near real-time speeds, which, again, right back to your question, helps us get quicker to detecting and stopping. If I can catch it closest to the device that it's on, I win. If it has to traverse the network from the machine to the switch to the net, to a hub to whatever, if I have to catch it later in, it's going to be really dangerous over here on this device. So the closer I can get to it on the device, and that's where EDR comes in.
That's great. Thanks a lot. And then if anybody else has any other questions, just put them in the Q&A or the chat, and then we'll circle back through them at the end. But that was very informative, Dave. Thanks a lot. Really appreciate your time. And
Happy to
now
help.
go to the next slide, please. Great. So I just wanted to introduce real quick another one of our security partners, Craig Sandman, who will be speaking for a couple minutes on the cybersecurity awareness and training platform. So go ahead, Craig.
Thanks, Ray. Appreciate it. Nice job, Dave, as well. It's great to hear what your organization's offering. Obviously, reducing risk and from a cybersecurity perspective requires a number of different solutions, never single-threaded. And what we do at Symbol Security here is we deliver security awareness training and related services through partners like Xtel and from a software as a service program. So what that results in, and we'll talk a little bit more about this from a benefit standpoint, is a managed training program. So many of our customers, although they can run their own training from a prioritization and just efficiency standpoint, oftentimes they'll turn to us or our partners to manage that for them while they focus on their core requirements in the organization. And what we're targeting with the services is human risk. Obviously, there's a lot of cybersecurity solutions required and necessary to shore up the technical vulnerabilities because there is a lot of those. However, identifying and correcting or retraining human risk is a huge part of the formula as well. Breaking down into the features of what these services deliver, there's a number of different data points and angles that we take to help reduce human risk. So one is finding out on the human side, email threat alerts. So if emails have been compromised, because that becomes a potential attack vector for cyber criminals. Domain threats as well are more corporate aim, but if there are doppelganger domains in the registries, that could be indicators of cyber attacks or imposter attacks. We deliver through engaging trainings. It's really important because from a human behavior perspective, trainings today have to be quick and to the point. People have been conditioned with a shorter and shorter attention span. So you have to get your message across quickly, has to be precise, it has to be memorable. And so by making users engage, we create that, that learning event. Similarly, on our phishing simulations, I will tell you if you're in a training program and the simulated phishing events are not good, your people aren't going to learn. They'll learn what a bad phishing simulation or what a bad phish looks like, but if they get hit with a good one, they might miss it. So authentic simulations are very important as well. And then from a reporting perspective, through Xtel, we make that super easy. So you can always have access to information, trends, et cetera, at your fingertips. And finally, we've launched a cyber threat surveillance service, which also takes a peek into the darknet and monitors keywords like your brand name, your corporate name, your product name, potentially IP address of your website or critical infrastructure. We monitor those things for activity across nefarious chat rooms and other places to give you a heads up as to associations of your properties in places where there's likely not good outcomes coming from them. And sometimes this helps get out in front of the cyber attack or the smearing effort or the extortion event. So that's what we do. And Ray, you can go to the next slide. And so just to kind of set the landscape for it, and I'm really going to zip through this because I think Dave did a really nice job previously, but cybercrime is a big problem. And it's very effective from a business model perspective. So as a result of that, how are we as businesses being asked to defend ourselves? What's happening is the burden's being pushed on the companies to do it. So yes, there's efforts being launched to try to reduce the crime itself, but the overwhelming trend is not to focus there, but to focus on businesses, putting responsibilities on businesses and requirements and regulations on businesses to best protect themselves from this onslaught that nobody seems able to really snuff out at the source. We could go on that topic for quite a bit, but the point is, if you're running a business, there is going to be more and more regulations and requirements thrown at you. One of which, if it isn't already a hardcore requirement, certainly you'll see it, is the requirement to prove evidence of having a security awareness training program in place. Next slide. So what can you do to protect your company and stay compliant? It's really a simple formula. Regardless of the features that we're providing, we're in a circular motion of educating your employees, testing your employees to make sure it sticks, and then looking for data and events that help us alert on either employees that are maybe not grasping the concepts and we need to re-educate them, or vulnerabilities to tell us, hey, this person could be vulnerable because I'm seeing, email, their corporate email was used on a, on a personal shopping site, and now that data is breached, and or that username password combination is breached, and so that's a potential vulnerability for you. And then we circle back and educate the employee on probably what their acceptable use policy is, how they shouldn't utilize email addresses, for personal purposes, corporate email for personal purposes, and come back and educate and test and continue to monitor. So that's the cycle we work through with clients. We have many clients that have told us over the years, hey, this is really working. And the formula is not magic. The process is really just effective. And it takes a certain timing interval and a certain formula of how you deploy this to really balance the number of hits you need to get an effectiveness without having sort of training fatigue. So we've really perfected that, but time and time again, our administrators say, hey, this is working. Like, people are more perceptive, they're on their toes, they're telling me more about potential incidents or incidents that they've seen. So it does work, and it doesn't. It's of course required by regulation in many cases too. Ray, next slide. Or team, next slide. Sorry. So just coming to kind of a philosophical statement here of where security awareness training was and where it kind of sits in the industry and what we're doing about that to make it more effective. And you know, I always chuckle when we hit October and it's Security Awareness, National Cybersecurity Awareness Month, and you see time and time again messages from companies: be careful, you know, be cautious when, you know, when responding to emails, or be careful when clicking on links. And you know, what is really required is specificity and training of what people need to do and what they shouldn't do, and specifically what they need to look out for. The industry's flooded with be careful, be cautious, but a lot of times people don't know what that means. Well, what do you mean? Like, should I read slowly? You know, should I not open an email? What does it mean to be cautious or be careful? And so this is kind of a, you know, a play on that scenario where, you know, people just get yelled at, you know, please just stop clicking on phishing emails. They haven't really been properly trained. They might have been told to be careful or be cautious 1,000 times, but they haven't really been properly trained. Next slide. And so what we do is we take that concept of be careful, or, you know, please just stop clicking on phishing emails. We take that down to a very tactical but fun approach. And we hit a number of different topics. So sometimes, you know, phishing simulation gets the headline for security awareness training, maybe rightfully so, but there are so many other spaces where an individual can either save the day or really damage the safety, the cyber safety of a business by being aware and making the right move when they come into a situation. And that starts sometimes with recognizing phishing emails, yes, but there's also verbal or other types of requests that maybe need to be validated before you take action. This is where process comes in and where procedures come in. And coming down a level, you see a lot of these attempts will trigger like a wire transfer request or a fake invoice, you know, paying an invoice that's actually not a real one. The request for sensitive information when it either should be validated or distributed through different means or potentially just not shared. There's all kinds of education to be done with respects to Wi-Fi, both corporate and business travel wise, where you can use and how you should use Wi-Fi. And then at your house, you know, how should you, if you have a work from home situation, you know, how can you leverage your network and then guest networks for, you know, everybody else that enters your house. Things like password managers come into the educational tract as well. And it really doesn't matter what a particular company's stance is on password managers, whether they mandate them for their employees, whether they recommend them, or whether they have really no position on it. You know, our position in our education is really about password hygiene. And from there, we will recommend password managers, but really it's up to the business and their policies. But these are the things, and the list goes on. Couldn't fit it all on the slide, but these are the tracks we take with educating employees. Next slide. And I just wanted to give an example of what I mean when I say, hey, it's more than just be careful or be cautious when you open an email. So here's an example of a very common circumstance where a very well-known brand like Netflix, you know, potentially sends you an email, right? You see the logo, it comes in your inbox, it says Netflix on it, and it's asking for some details, some sensitive information. So right away, you know, if a brand is emailing you and asking for a change or anything related to payment or credit card, now your radar should be up, right? But first, let's technically assess that email. And that's what this highlights here. So I know the writing is kind of small and the images are kind of small, but you know, the first things we encourage users to do is interrogate the sender name. So who is it actually coming from? Yes, it says Netflix, but what is the sender name actually? And people sometimes don't know. Well, you can click on that sender name and see the email address that it's coming from. And down in the circle on number 3, this is where it's probably too small to read. But if you were to read that, it's not a Netflix email address. It's not coming from Netflix. So right away, for our trained users, they will disqualify that email and delete it just on that purpose. And there's other steps as well that can be taken, and we can go to the next slide and we'll talk about those in terms of phishing takeaways. So we just went into detail on validating the name and the sender name. What can happen if there's a better attempt made than that last email in terms of manipulating the email sender name is you'll see a subdomain inserted that can distract a user from the actual domain. So we teach about that, how to understand that. It is technical, but it's not that difficult, given a 30-second explanation. So we help users understand how subdomain manipulation could lead to something like, amazon.passwordconfirmation.com, where Amazon's in there, but password confirmation is the domain it's coming from. The top right there, where we talk about hovering over links, a lot of people are familiar with that, and that's good. So people understand that if they position the mouse over a link, they can see where the redirect is going to take them, and if they can't directly associate with that redirect, like they can see from, for instance, a Netflix email, like the redirect is taking them somewhere else, then in that case, you have a scenario where this is probably not a safe click. And then finally, in the last part, and this is where I think the industry hits most, is, hey, does this situation seem weird? And yes, of course, you have to have that assessment too. But first, there are those technical checks you can make. And so over time, as our users continue to get conditioned, they get very good at going through these technical checks. So we can go to the next slide. So that was phishing and just really being technically assessing emails. There's also heads up around common scams. And in healthcare and other sectors, these play out as well. Probably the number one scam is the attempt for, a wire transfer or a redirect of any ACH transaction or any bill payment. But we do see a lot of attempted requests coming into accounts payable or finance organizations, with a request from, air quotes, somebody in charge or somebody internal. Obviously the email's not internal, but if it comes in, it would be, posed from somebody that had authority who would say, I need, X amount of dollars transferred from this account to that account, which could be a normal request. Sometimes it's conditioned with, and I need it done urgently, and I can't call you because I'm tied up in a meeting, so please get this done, right? So, so that the mixing of urgency and a specific topic like that can fool people if they don't stay in their process and they don't do that important verification. Phony invoices are also very common. So a typical situation would be a vendor, like let's say a medical supply vendor or something along those lines, gets breached or their customer list gets acquired somehow. And now they have contact information for every account payable customer that they have, including account information and contact name. So now it becomes very easy to deliver a fake invoice to a hospital or to a medical practice that looks exactly like a real invoice because they have all the information. However, there's usually something different about it. Amounts are different, or wiring information is different. So it puts the burden on accounts payable to identify that, and generally there should be a process in place. So also requests for sensitive information. Obviously in healthcare, you're conditioned from a HIPAA perspective and PII, but other types of sensitive information can be asked for as well. And sometimes with healthcare organizations or any of those that are nonprofit or have donors, that becomes attractive targets as well, because sometimes there's donor information that's very sensitive, but because they have a relationship as a donor to a medical practice or for a cause, now their information is sitting with the healthcare organization, and through charity events and things like that, people get conditioned to know, hey, where are the, you know, the big money people going? And if they're known to be donors of a certain cause or a certain entity, now that becomes a target to be attacked as well. So we see these as common scams, and you know, when you have good sense, you know, you can sometimes pick up, you know, when scams are about to happen. But going back to that phishing simulation assessment and just following verification process, these are things we teach and we reiterate, and over time we work our way consciously and subconsciously into an organization so that the people become more safe. I think that might be it. Yep. So I don't know if there's any questions on awareness training or any of the things that that I just discussed, but if there are, I'm happy to take some of those questions.
I got one that popped up for Craig. The training is 100% digital delivery. Is that a correct assumption? The question is, do you have a live body mechanism, or is the delivery all digital?
The delivery is done through our learning management systems. So that's the model that we work through, and you know, we can work within other learning management systems, but our model isn't a show up in person and you know, speak live to a conference room. I would say, Ray, if you do have questions about altering the delivery model, we should entertain them and see what's possible. But the model that the software produces and that's been very effective for all of our customers is a digital delivery model. There are ways to address users that don't have laptops or don't have access to computers as well. We could talk about those. But yeah, the core delivery of the service is through our student portal, which is an online learning management system.
Great. And then there's another question for Dave. If a customer already loves their firewall, they love their firewall vendor, they're using Cisco today, and then they also have an EDR in place that they've invested a lot of time into so far with like Carbon Black or one of the other competitors, can they still subscribe to the service? And then what additional benefits would they gain?
Yeah, absolutely. The one thing that we didn't talk much about is we built a strategy about being vendor agnostic. So at the end of the day, I don't care what tools our partners and our end customers bring to the table. We bring all of them, Carbon Black, Palo Alto, Cisco, you name it, into that SOC platform I showed you. And now we're correlating any of their toolings together. We'll correlate their proxy and their EDR with their Palo, and we'll give a risk picture. And then more importantly, because we're tying it together, we're reducing that mean time to detection, which subsequently leads to mean time to response goes down, and then we layer that automation on top of it. So for example, Ray's machine is doing something funky, we detect it on Carbon Black, we learn from that behavior, and we tell the firewall, if you see this as well, go ahead and block it. And so there's ways to, again, we don't want to be tied to a particular vendor, because tomorrow there may be a new EDR vendor that comes out of nowhere and has the best toaster. And I want to be able to say, you know what, customers, this is the best thing for you. We'll plug that in as well. We'll build our automation on top of it, and it'll be available to the customers. So we honestly, we just don't care. We want you to have a framework. We want you to violently execute that framework, and we'll lay the automation and management on top of it all.
Awesome. Well, thanks a lot, guys. That's all we've got for everyone today. Thank you for joining the XTEL Cybersecurity Healthcare webinar to discuss these topics. We appreciate everyone signing in and hope you learned a little bit today of how to improve your cybersecurity specific needs and challenges. Feel free to contact us, reach out to your account manager, put our phone number and the Xtel sales email address up here. So if you have any other further questions, want to get in touch with us, want to do a deeper dive on the product demo, the product demos are very, very helpful. And they're also on the both products that we've talked about here today and some of the Xtel's other products with the managed firewall and the DDoS protection. Schedule a call, schedule a meeting, and give yourself some time to really digest, what we're presenting and the tools that we're providing. So again, thank you all for jumping in, and then that's all I have for today. So thanks, Dave, thanks, Craig. Thanks, our attendees.
Yep. Thanks for the invite. Appreciate it.
Thank you.
Thanks, guys.